Hi, I'm Jeff Garbacz. I'm with Great Lakes Seminars. I'm the instructor for the extremity mobilization class, and I want to share with you a technique to help your patients with hip mobility. This is an anterior hip glide with a mobilization belt performed in supine. So this is a technique that I have been doing with patients for many years, and most recently was exposed and taught to perform this in a supine position, which is much easier, much more effective, and the feedback that I've received from patients has been much more positive than the prone versions that I was using prior. So I'm going to demonstrate this with Courtney here, who's going to help us with the demonstration. So with the belt, you're going to take the belt, you're going to wrap it around the patient's leg, and you're going to ask the patient to pull the belt up close to the groin, just being aware of personal space with where that belt lies. As you hold the belt, you're going to take your outside hand as you face the patient, you're going to push it up towards the patient's head, and you're going to loop your shoulders through the belt. So the belt should be on your inferior shoulder as you're doing this mob. And the important part of this technique is to have the belt up near the groin of the patient's hip, and then it wraps around, and as it comes around your body, it acts as a really nice fulcrum. And so you want good tension on the belt. You're going to hold the patient's leg down, and then the glide occurs just by you standing up out of your squat, and as you're standing up, you're bringing that femur in an anterior direction to get an anterior distraction of the hip. The patient should feel a stretch kind of in this anterior aspect of the hip. As you hold it there, it's more of just a sustained distraction. If you wanted to increase the range or increase the intensity of the pull, there's a couple things you can do. As you're holding that anterior glide, you could ask the patient to do a glute set by basically just squeezing their butt. And as they do that, they'll feel that stretch intensify in the front, and then she can let go. And then she can squeeze again. And then she can let go. So that's one way you can progress it. A second way to progress it would be to bring the patient's leg off the edge of the table and let her come into kind of a dangle position. So now I have her into more of a hip extended position. And now, as I stand up, that stretch can be intensified through the front of the hip. Okay, so this is just a really nice way to increase extensibility in the anterior hip, helping patients with extension through the hip for patients that need motion or mobility in that direction. I hope you find this helpful with your patients.